All right. Good afternoon, everyone, and welcome to today's Lunch and Learn, Pandemic Parenting, Building Resilience, and Finding Joy. Today's webinar, once again, sponsored by Imprints Cares. My name is Devontae McKenneth. I'm the morning anchor at WXI 12 News here in the Piedmont Triad. And like I said earlier, it's such a pleasure to be here with you all this afternoon, especially during that lunch hour, right? I promise you this will be very, very beneficial for each and every one of you. If you're at home or in the office this afternoon and you have a question for any of the doctors involved, feel free to leave that in the Q&A portion of this feature, and we'll try to get those throughout the conversation as well. I don't have to say this, but I want to. This COVID-19 pandemic has certainly changed and impacted our lives day in and night out in many ways. And we continue to learn more about how it's impacting the mental health of our children and adolescents in our very own community. This afternoon, we are joined by Dr. Naomi Leslie and Dr. Stephanie Daniel. Both are very, very qualified to offer practical suggestions for dealing with some of those issues that our youth and younger people are experiencing during the course of this pandemic. Dr. Naomi Leslie is a board-certified child and adolescent psychiatrist. Her official titles, plural with an S, titles are Assistant Professor of Psychiatry and Program Director for Child and Adolescent Psychiatry Fellowship at Wake Forest Baptist Health, as well as the Medical Director at Cross North School and Children's Home. Dr. Stephanie Daniel is a clinical psychologist affiliated with Wake Forest Baptist Health as well, and their Department of Family and Community Medicine. She also served as the Executive Director of the Shoal Health Alliance. Dr. Leslie, Dr. Daniel, thank you both for being here this afternoon.
Thank you, Devontae.
You bet. Dr. Daniel, we'll start with you, and I understand you have some slides about resiliency that you want to share.
Sure. I think Shannon's going to pull those up for us. Thank you, Shannon. And the next slide. So good afternoon and welcome again, everyone. We're excited to be here. And I think that I've heard that one of the most commonly cited words about the last 14 months has been unprecedented. So I'll use that word again. It has certainly been an unprecedented 14 months. And today we hope to provide you with a framework for thinking about parenting during the pandemic as we continue the journey through the pandemic. We hope to also provide you with some strategies for thinking about how to build resilience and maybe find your joy or reconnect with your joy despite the pandemic. So I'm going to start us off by just sharing a little bit about a framework that, again, I hope will be a guide for all of us as we have the conversation today. So on the slide, I know there's a lot going on in this slide, but this is a slide that comes out of the ACEs Connection website. And it's one that's commonly used to sort of showcase what we mean by adverse childhood and community experiences. And there are three things I want to sort of highlight from this particular slide. So one, adverse childhood and community experiences can occur in the home or our households, and that's reflected in this picture by the tree top in particular. Adverse childhood and community experiences can happen in our community, and that's reflected by the ground and the roots surrounding the tree. And then the third area, and the area that we'll focus most on today, is the adverse childhood and community experiences that can occur in our environment. And the environmental adverse childhood and community experiences, as you'll see, really reflect more natural disasters and things that occur within our world, most of which that we have no control over, right? And the pandemic is certainly one of those events that we haven't had much control over for the last 14 months or so. So next slide. So it's important as we think about the slide with and the impact that household adverse childhood experiences have and the community adverse childhood experiences have and the environmental adverse childhood experiences can have. It's important that we think about how do we stay and remain resilient despite those stressors and those traumatic events that occur in our lives, whether they're at home, in the community, or the environment. So this this slide really just reflects a framework for thinking about how we can stay resilient and build resilience. And we call this, in our world, we call this a resilience zone. So if you think about this box as your resilience zone, and you think about the charges and release, the charge is the stress, which usually builds and creates some anxiety or fear or some other types of stress in our world. And then the release is where we feel like we've gained control over whatever that stressor might have been. And then the charge is the sort of next stressor they may come our way. And this is sort of the natural ebb and flow that just happens during our day-to-day lives. And, you know, sometimes the charges that we experience or the stressors that we experience are small. It might be that someone pulls into our lane while we're driving, right? And it's stressful because you have to think quickly and move quickly. And then once you've done that and you've done maybe some deep breathing, then you have that release. And then the next charge might come our way, right? So that's just sort of the natural ebb and flow. And so if you think about the resilience zone, it's really that place and space where we all have the capacity for being flexible and adaptable in the way we think, the way we feel, and the way that our body responds physically, and just our overall, how we feel in terms of our spirit and our general well-being. And so folks, when we think about our resilient zone, folks also talk about self-care. You've probably heard the phrase self-care before. Others might call it mindful self-compassion, which just is a fancy word for self-care. But it's self-care, and we're going to talk about resetting here in just a minute, that helps us deepen our resilient zone and to stay in our resilient zone. Next slide. So you'll see, like the last slide really kind of showed just again that normal ebb and flow of what daily stressors might look like. This slide looks much more chaotic and is a little intimidating when you first see it. So, but the lightning bolt reflects the pandemic, right? Like the pandemic came in big and strong and powerful and impacted all of our lives. It changed our schedules, our normal routines. It changed, in some cases, our jobs and our finances. And in many cases, we've experienced loss of loved ones or family members or friends as a result of the pandemic. For our children, it's changed their school day, right? That was a major part of their normal schedule and routine that has looked very different since March of 2020. So, so you've got that lightning bolt coming in, and what we know can happen is that lightning bolt can impact the other stressors, the other charges that come into play, right? So you'll see the black line reflects the normal ebb and flow, but you've got that lightning bolt coming in, and you can see that our reactions may vary or change as, and our what our normal reaction to a stressor might have been when they're layered on underneath of the pandemic. Our reactions might change, right? They might be more severe, and it may take us longer to release or to recover from those stressors that are occurring in our day-to-day lives. And one thing that we're going to be highlighting today with some of the parent questions that have been submitted in advance is that it can happen where folks get stuck in the high zone. And you might witness that or observe that either in yourself or your family members by someone being just a little edgy or irritable, or like they might be manic or experiencing a sense of mania. They might experience anxiety or panic or fear, or they might have angry outbursts. And some folks may actually experience physical pain or emotional pain as a result of being stuck in what we call that high zone. Then others can get stuck in the opposite direction, right? Stuck in the low zone. And there, what you might see or observe is that someone is depressed or sad. They might feel isolated. They might feel extremely tired, exhausted, fatigued, or they might just feel numb and not really feel anything. And so the examples that we're going to share today reflect being stuck in the high zone, being stuck in the low zone, and provide some examples of what to do and how to respond when you're in one of those places and you can't reset and get back in your normal ebb and flow zone, which is our happy place, right? So that's where we all want to be and stay. So the other thing that I'll mention here is think about just individually, like staying in your happy place, staying in that kind of normal ebb and flow of the stressors that you see each and every day. And layer that as a parent, layer that onto the fact that your children, if you have one or more children, they're also ebbing and flowing, and they may be going out of their zone, either in the high direction or the low direction, and may also be having trouble resetting, right? So as a family, what I want you to think about is that this can impact you not only at the individual level, but as a parent, we're also trying to pay attention to where our children are and thinking about, are they outside the normal ebb and flow? Are they outside their resilient zone? And the last thing I'll mention about this slide is that it's also important to remember that our resilient zones all look different, right? Like some of you may have really wide resilient zones, and it takes a lot to bounce you outside, either up or down, right? And others of us might have very narrow zones, right? And part of that, again, depends on what those lightning bolts look like that are coming into our lives, right? Because those impact how we react to minor stressors, even in our day-to-day. So think about that too, and that individually and as a family, you might have different zones, and it might take less for some of your family members to bump outside the zone and to have more difficulty getting back in the zone. Next slide. Let's see. Next slide, Shannon. I think we've lost our slide. So let's see. Here we go. Well, I'll keep talking and then our slides can catch up with us. How does that sound? So
all technical difficulty working on the slide.
Okay, that's okay, no worries. So the other thing that we want to think about, oh, here we go, is as you think about your zones, both your individual zone and your family zone, it's good, again, to think about where you are in relation to each other. And it's good to sort of track your zones, both individually and as a family. And I like to think about this as thinking about natural transition points where it's easy to sort of do a self-check or a family check, right? So it might be at the start and the end of a school day. It might be as you're starting work or leaving work or transitioning back home after work. And just kind of checking in with yourself to see where you are in your zone and checking in with your family members to see where they are in their zones. It's also important to just pay attention, particularly for young children and sometimes even older children and adolescents. They're not always self-aware about where they are in their zone, right? So as a parent, you may need to pay extra attention to what are they saying? What are you hearing from them? What is their body language telling you? And you may have to track for them as a parent in order to assess kind of where they are. And sometimes as a family, there may be times where you need to postpone or delay interactions or conversations because you know that either you or someone in your family or more than one member of your family are outside your zone right now, right? And it's not a good time to maybe have a sensitive conversation. It may be something that you need to postpone till you all feel like you're back in your zone or at least closer to your zone. And you can see from the picture here, sometimes it's a really precarious balancing act, right? Like finding the zone and staying in the zone and And that natural ebb and flow that I refer to as our happy place. Sometimes it's hard to find that. So we're going to talk a little bit about some strategies for doing that here. Next slide. So we like to think of this as a reset. One strategy for both staying in your zone and reconnecting with your zone is to reset. And so I think oftentimes you may not call it a reset or a need to reset, but I think as individuals and families, we often do recognize when we're operating outside of our resilient zone. And again, we may not even call it a resilient zone as a family. That may be a new term or phrase for you. But we know as a family generally when things are off kilter and need some adjustment. So during those times, it's helpful to think about ways that you or your children or other family members can reset. And by that, we are really talking about what we referred to at the very beginning, which is engaging in self-care. And this helps, again, in order to help you navigate back into your respective resilient zones. And, this is probably the topic for a whole nother lunch and learn in the future, where we talk about like strategies for resetting, because there are so many great ideas and things that you can do to reset. But just know that the general idea is that resetting can be accomplished by using what we call a planned resource. And this is just any person, place, thing, experience. It could be a thought or a quote, anything that brings you joy. And then the other piece to resetting can be just engaging one of your 5 senses. So taste, smell, sight, sound, and touch. And then a personal favorite of mine is deep breathing and relaxation strategies. Like sometimes in the moment, just taking 3 deep breaths in and out and releasing is enough to kind of reset your body and to get you back into that natural ebb and flow that feels good to us. So let's see, Devontae, I'll turn it back over to you. And I think we have our first parent question.
Yes, Dr. Daniel, I do want to bring in this question about resetting. Is that only when you're outside of your zone, or can you reset while you're inside your zone in order to avoid going outside of the box?
Yes, great question. So absolutely, you can definitely use the reset techniques when you're in your zone, but you might be concerned that you're at risk of moving outside your zone, either up or down, right? So it's great to use it when you're in your zone. It's also great to use it to try to get yourself back in the zone.
Awesome. Well, thank you both so much for your time this afternoon. And thank you all our participants for coming in to our webinar on this Tuesday. We will be sending out more information about the programs that Imprints Cares offers to all the participants rather. That will be sent out sometime today, I believe. And you can also always find much more information at imprintscares.org. Dr. Stephanie Daniel, Dr. Naomi Leslie, thank you so much again.